cardiac cycle is divided into 4 distinct phases, 2 each for systole and diastole. In this chart of chamber volume and pressure, the graph begins in the middle of phase 1, diastolic filling of the ventricles. This is a passive process during early and middle phase 1, with the blood draining from the atria and into the ventricles below. At the end of phase 1, the atria contract before the mitral and tricuspid valves slam shut. The contraction occurs immediately after the P wave in the ECG and causes a slight jump in the pressure of all 4 chambers as well as the volume of the ventricles. The closing of the mitral and tricuspid valves corresponds to the S1 heart sound. Just as phase 1 ends, the ventricles depolarize, causing the QRS complex in the ECG. This is immediately followed by phase 2, a very short period of isovolumic contraction, where all 4 valves are closed while the 2 ventricles contract. This rapidly increases the pressure inside the ventricles until they exceed the pressures of the aorta and pulmonary artery. Once the pressures in the ventricles have exceeded the aorta and pulmonary artery pressures, the aortic and pulmonary valves open and blood rushes out from the ventricles. This is phase 3, the ejection phase. Ventricular volume drops sharply in the beginning, but then the decrease slows and the ventricles repolarize, causing the T wave in the ECG. Fourth phase begins when the aortic and pulmonary valves close, causing the S2 heart sound. For a short period called isovolumic relaxation, all 4 valves are closed as the ventricles relax. As the pressure in the ventricles dips below the pressure in the atria, the mitral and tricuspid valves open once again. This is the start of phase 1, and the ventricles begin refilling rapidly, but this increase slows as phase 1 continues.